Watch tonight, the FDA is adding its strongest boxed warnings to several popular prescription sleep aids because of concerns about potentially serious side effects. Dr. Mallika Marshall is here now, and what drugs are we talking about here?
Okay, so this isn't news about some of these drugs because we're talking about common brand names like Ambien, which we've heard about in the past, as well as Lunesta and Sonata. Now, the agency found that there were 66 cases reported of patients taking these drugs and doing activities that resulted in serious injury or death. Because in rare cases, these drugs can cause people to do things while they're not fully awake. Things like sleepwalking, sleep driving, raiding the refrigerator, wandering outside, and even handling a firearm. Now, they can occur without a prior history of doing this. They can occur at the lowest doses of these medications, and they can occur after taking just one pill. So manufacturers will now be required to put their strongest warning on the boxes and the labels and the patient information sheets. And obviously, if patients are taking these medications and they experience any of these unusual sleep behaviors, they should stop taking it. But unfortunately, sometimes they don't remember doing them.
I was going to say, people know that they've done something. I mean, I guess if you wake up and you're in your car, or
exactly. But
or doing the news.
Sometimes you get you raid the refrigerator, you get back in bed, and you wonder why your kitchen's a mess. But hopefully, there'll be a witness.
Yeah, that's it. I was sleeping. I didn't mean to. Why does a person find a particular odor pleasant while another might find it offensive? Researchers have found that small genetic changes can make a big difference in how we smell. Doctor, this helps to explain why some people find perfume pleasant, other people don't. Is that right? Yeah,
so when odor molecules enter your nose, they can activate about 400 olfactory sensors, but in a variety of combinations that can result in millions, if not trillions, of different smells. So researchers at the Monell Center in Philly had about 300 people rate different odors and then studied their DNA. And they found that genetic changes to a single sensor can affect how strong or pleasant a person finds an odor. So, I was thinking about asparagus. Asparagus?
Jeez.
Do you smell asparagus? Are you able to smell it? Okay, well, I do, but not everybody does. And it turns out it's probably genetic differences that allow some people to smell the lasting effects of asparagus and other people not to.
Okay.
Pee-pee.
All right.
Pee-pee.
Oh, boy. Dr. Mallika, thank you. Lisa.